So with that, I'm going to introduce our first speaker, Dr. Chris Covert-Bowlds. And Chris was born in Pensacola, Florida, and he was raised in Peabody, Massachusetts. He came to Washington State after graduating from Dartmouth College in 1984. And for 1 year, he attended the Jesuit Volunteer Corps in Yakima in a low-income legal service office. He graduated from the University of Washington Medical School in 1991. And practiced in the Swedish medical medicine residency there in 1994. He's been in private practice. Until 2005. At that time, he joined the Interfaith Community Health Center, and he's been at the Ferndale Clinic since November 2008. Dr. Covert-Bowlds, if you know him, he is a very strong advocate, an activist, and a strong believer in the right that everyone should have health care. Dr. Bowlds.
Thank you, and thank you for coming out on a nice evening. I hope we can share some thoughts about this whole topic. I'm very thankful for Donna being here tonight. So I work at Interfaith Clinic in the Ferndale Clinic. We also have one in Bellingham and a smaller one at Point Roberts. I've been there for many years. Our clinic in Ferndale just about 1.5 years now. And every day I see people suffering for lack of access to health care. Quite a few with no insurance, quite a few with insurance that has a huge deductible, so it's underinsured or essentially uninsured. And every day I try to encourage people to kind of take charge of their own health. When people have no health coverage at all, they're very motivated to take charge of their own health and try to do it as economically as possible. But in the same way that every American, if accused of a crime, has the right to legal representation even if they can't afford it, I think it's way past time that every American should have right to health care access. And we're on the front lines doing that. I say that, you know, if the Marines are the point of the spear of the Army, of the military, we're sort of the point of the spear of health care access and the lack of it. So at Interfaith Clinic, we see children who in this state are doing pretty well with access to health coverage. Seniors, almost all of them are covered by Medicare, but the people in between, especially the working poor, many people self-employed, small businesses that can't afford health coverage, these are the ones that are caught in the vice and are just really suffering. Having seen a woman with a large breast tumor who was deathly afraid of having it looked at because she, I think, knew it was probably cancer, delayed much too long, and finally came in with a family member's visit and was dead within just a few months in her 40s for what probably would have been a completely curable cancer if we'd caught it early in time. I thought that's a classic American healthcare disaster. I mean, it's just, it's amazing the suffering and the premature deaths we see, and almost everyone has someone else that is connected to them. So it's hardly ever just the individual that suffers, it's their family. Seeing the amazing, you know, we medical folks kind of think, oh, this is so horrible, their health care suffering, but the financial suffering that we try to help people address, that's just magnifies everything else. To think of bankrupting, you know, yourself and your family and losing your home because of healthcare problems. That's just an American thing. So seeing this every day, signing death certificates. You know, I signed her death certificate saying what was the underlying cause of her death. I said it was for lack of health insurance. And the medical examiner says, that's not a cause of death. So, you tell it to the family. It sure was in this case. So I said, nope, cannot accept that. Change the death certificate. So I had to change her death certificate and say, oh, okay, it was just breast cancer just because. But clearly, you know, lack of access. We have the most wonder, if you have the gold card in the U.S., We really do have some of the best health care in the world, but if you can't get it, it just doesn't matter. So I'm happy to say, after many decades of kind of avoiding the issue, the Cancer Society is now firmly on board saying, oh yeah, I guess we have this great cancer treatment and great cancer prevention, but if you can't get it, it doesn't really help much. Now they're firmly on board with efforts to try to get universal health coverage. They could always use a little extra reinforcement, both a thanks and a prod, you know, like they say in the Navy, a pat on the back and a kick in the butt, to keep them doing that, because it's not as sexy and kind of mainstream. It's not all pink, you know, to say that everybody needs health insurance and that we need to fight like hell to make it happen. But so it's not as nice of an easy corporate sell sometimes for their big corporate donors. But so any of you involved in Cancer Society or healthcare issues in general, every time you have the chance to bring it up to someone who has some power to make some decisions about how they really put the rubber on the road, I would strongly stick up for that. Say, you know, people with cancer, we're all prone to get cancer because we're human beings, it can happen, and you never know. But making sure that that everyone has health coverage in case they get it, or to help prevent it or catch it early is very key. Saw a woman who had no health coverage and had clearly some heart problems, did the basic workup we can do at Interfaith, clearly needed to see a heart specialist. We have kind of a rotating fund that the specialists chip in, and we'll see people on a rotating basis, you know, a certain number per month on some sort of discount, and they can discount their own fees because they control that, and they're very good and then very generous in doing that, and specialists who make a ton of money, so they can help out that way. Explained to her the whole process, and you know, tried to expedite all the referral and get it all happening, and despite many efforts for us to try to make sure that happened, never quite made that connection. And within a year there, she passed away at a very early age, and so I'm writing her death certificate, you know, heart disease, underlying cause, lack of health insurance. And to see that time and time again, it's just amazing how much suffering goes on. You know, the worst case scenario is dental and mental. You know, I tell people mental health and dental care are sort of the orphan children. You know, the brain and the teeth are not connected to the body in our healthcare system. So, well, you know, well, the heart specialist a few years ago, they were putting letters in the paper saying, you know, we're doing heart surgery on people because their heart valves are falling apart because of their bad dental decay. You know, so they get it. They know how important it is, but our screwed up system still doesn't get